My name is Maya Luria with TMC for Seniors, and we are continuing on with our Fall Prevention Month, and we're going to be discussing fragility fractures, what you need to know. I have Dr. Ty Endean here with me. He is a TMCOne Orthopedic Surgeon. How are you today, Dr. Endean?
I am excellent, thank you.
Good. I want to just share a little bit about you, if you wouldn't mind. Dr. Endean is an orthopedic surgeon and he specializes in sports-related injuries. He's a firm believer in empowering patients in their own health and treating them like they are a part of his family. His goal is to get people back in the game. So the game of life, the game of sport, the game of work, and the game of being a parent. He likes to help people get the most out of life. And he chose his career, his healthcare, as his career path because he likes to help people. So that's so wonderful, Dr. Endean. I know this is your first time here with us, and we're thrilled to have you. I'm going to go ahead and put your PowerPoint up for you so that you can get started. And I'll join you at the end in case we've got any questions from our online audience.
Thank you. So today we're going to talk about fragility fractures. So our objectives are to learn a little bit about everything, some of the pathology, some of the medical things, some of the treatments, more importantly, how to prevent things. Because the more you fall, the more you're at risk. As we get older, things are a little stiffer, they break down a little easier, and we don't recover quite as fast. So as we get older, we fall more frequently. There's a multitude of reasons, whether it's our brain processing power not being as acute, whether it's the stiffness in our tissues, so we can't accept the stresses that are applied. And these numbers are kind of frightening in a sense, if you look at those, as far as the frequency of falls as you get older. And, our population is getting older and we're getting more active as we're older. So my number one fall right now is on the good old-fashioned pickleball court. So, there's the Ty Endean's pickleball tournament going to happen every weekend because it's a good source of helping people. In the population that's sitting in this room, there's about 1 in 3 of you that are going to have a fall in this course of this 12 months. Those that aren't here today that may be online, that could go as high as 50%. That's kind of a frightening number. Oh, that was supposed to be gone. So here's kind of the different things that happen with a fall. So you can fracture a bone. That's probably the worst thing that could happen. You can have a fracture and a dislocation or just a dislocation. That picture there is a picture of a hip and that arrow shows a broken hip. So it's not quite supposed to be lined up like that. That particular patient right there would require surgery. That surgery would be done in the hospital, probably take about an hour, and honestly, it'd probably take you about 2 to 3 months to fully recover. That is something that's recoverable in my world, easy to fix. The picture on the right of that is more worrisome to me. And what that is a picture of your brain. And where you see that dark area, that's blood the white area, that's blood that's pushing on your brain. And so in this case, that person is probably having neurological compromise, stroke-like symptoms, and if it's not treated, that could be permanent. That person too would require surgery where they would unfortunately drill a hole through their skull and drain all that blood out. And then we just hope that they recover neurologically. So for me, in the world of orthopedics, the things that happen in my world are generally fixable. For me, it's the neurological things that happen that are more worrisome. Now, you don't have to break a bone. You can just bruise things. I saw a lady in the office today. She slipped in the bathtub and fell and hit her knee and hit her head. And so she came in just to make sure she was okay, and she was. But, the frequency of that is, pretty high, 1 in 10 in women, which is higher than men. I think as we get older, a lot of that has to do with your muscle mass. So women in general have less muscle mass and they're less active in their elderly life than men routinely, not all. And so as you lose your muscle mass, you're at a higher risk. Now, in my world, falls are the #1 cause of a hip fracture. Now, here's the funny irony of that. Most hip fractures do not happen as a result of the fall. They cause the fall. So if you get your foot caught in the carpet or your oxygen and you twist because your bone is weak through age, fragility fracture, your hip breaks and you fall. That all happens in nanoseconds. You perceive it as I fell and the ground caused the fall. That's not actually the case. Most people in the elderly population, it is the fracture, then the fall. So here's another statistic that's not so great. If you fracture your hip age 70 and beyond, it is a possibility, according to your other medical comorbidities, that you could have end-of-life experience in 6 months. So preventing those things from happening is kind of important. And so hip fractures happen more frequently in the older person. Again, we talked about that and the weakness of their bone. And again, most people don't recover to their full status. A lot do. Those are ones that have healthier bone and overall better health condition. Those that do have poor bone, of course, they're going to use more services, the healthcare system, rehabilitation, whether it's inpatient, outpatient. And then there's a plethora of things that happen in side effects or complications, blood clots, pneumonia, urinary tract infections for both men and women. All of these things can happen as a result of a side effect of your fall. So again, prevention, prevention. It's going to be the theme of our talk today. So what are our risk factors? So obviously, older age. Women, because your bone is weaker due to you're at higher risk for osteopenia and porosis. Women generally have a lower muscle mass comparatively to a man their same health status and age. As we get older, our eyes tend to go. Our balance tends to go. They're linked. And so we're at a higher risk just because of the aging process. So it's really imperative to take care of your eyes and wear your glasses so you have knowledge and awareness of things around you. So you're not tripping on the dog, you're not tripping on your oxygen cord or the carpet that's rolled up in front of you. As we get older, our vascular system doesn't respond as quickly. So a lot of people, if you've been sitting too long, sometimes you need to stand and not move. And if you do feel a little lightheaded, sit back down. Or if you're lying down, sit at the edge of the bed before you stand up. Just don't rise and go. I'm 58 years old. I stand up at the edge of the bed and I don't move for about 4 seconds just to make sure I think all the parts are working, and then I'll go about my day. Of course, we talked about some of the environmental factors, uneven floors, so going from your carpet to your saltillo tile, obstacles that are in our house. I don't know about your houses, but sometimes I feel like my house is cluttered because there's new things that my wife feels are very necessary to make the aesthetics of the house look better. And so it takes care of my mental map through the house that is now changed. As we get older and we need things like wheelchairs or scooters, things like that are helping you through the house, those two can be obstacles that can cause a fall as well. And of course, electrical cords and poor lighting. The lighting, again, is back to your vision. Why should we reduce these falls? Well, we've kind of talked about it in the common sense approach of everything, but in the scheme of our healthcare system, it is very, very expensive. And I don't know what your experience has been with the healthcare system. Mine personally has not always been a favorable one. Whether you're trying to get services, whether you're trying to get to see doctors, it's very difficult and it's not getting any better. And unfortunately, less and less providers, whether you're a physical therapist, a doctor, in many ways, there's less of us now. And so getting in and just getting simple services are harder. And the more expensive as our health care plans are changing. We're supposed to have this great Medicare insurance we were told in our youth, and it's very expensive and you feel like it's back in your working days. So can you prevent all this? The answer is yes. A lot of these things are preventable. So you can do that through your own health and staying stronger and more fit. You can change your house and the environment that you're living in. Medications. So it's kind of the healthcare system again. There's a lot of people with their hand in the jar, and it's not always somebody watching over everybody. And so a lot of you are on way too many medications that have side effects with blood pressure and various things that affect your ability to move about safely. And so I always encourage people to have somebody driving the ship, meaning it's supposed to be your primary care physician, could be a cardiologist, it could be you nowadays. And, you know, we have wonderful things in internet to research, and that's great. Be careful, because it's where you're getting the information. I think of the internet for you all, and myself as well, as just a starting point. Don't take it verbatim. And there's a lot of interaction between drugs, and if you're doing things nutritionally, adding things, a lot of things interact. So your pharmacist is a good person to talk to. You should have a pharmacy. If you're on multiple medications, you should review your medication list with the pharmacist at least once a year, in my opinion. Now, your doctor's supposed to be doing that, but again, I think we all have to be proactive, and we have to take accountability for ourselves, because we're the only person that cares. And that's not to speak poorly of internal medicine and primary care, but you have to be your own advocate. It's been my personal experience. May not be yours, it's been mine, so it's what I'm sharing with you. So, exercise. It's a wonderful thing. It's going to keep you stronger. It's the best way to stimulate bone growing and healing and maintaining your bone. It doesn't have to be go to the gym and lift weights. It's just activity against gravity. I think it's the one thing that you can do that you can control better than anything else. Now, if you have arthritic knees and hips and walking out on the street is hard, I always recommend walking the pool. The pool takes a little bit of weight off of you. If you get a hitch in your giddy up, you fall over and get wet. So what? You stand back up and you go about your day. If you walk fast in the pool, it's a lot of work. So you can moderate your own exercise, so to speak. You don't have to go to the gym. We can use gravity in the good old-fashioned outdoors. The outdoors, called sunlight. You know, Arizona, for our 300 plus days of sunlight, we're all vitamin D deficient, probably just about everybody in this room. So we have the best thing, sun. We all avoid it. Wear hats, we put lotion on, we cover up clothes. There is benefit to that. Now, I don't want you to get skin cancer either, but there is benefit to just a simple walk outdoors. There are exercise types. Tai Chi is one, other martial art forms are another, where it's low impact, you're moving slowly, safely, you're developing your balance, you're developing the strength for balance, and again, you're working against gravity. So it's something that can be very beneficial for you. And as studies have shown, it can reduce your risk significantly pretty quick. If you think about a weight loss journey, if you've got more than a few pounds to lose, then you're not planning on doing it in 2 days or 2 weeks or 2 months. You're looking at a 12-month or more process. So if you think about your health and your safety, think of it in the long term. None of us know how long we're going to live. So, you know, plan for living for a while and be prepared for it. Now, if you look at that cartoon picture, there was all kinds of chaos going there. Now, that's not my house because I don't have stairs, but that could be my house at times when my kids were still living in the house. And so there's things always in the way to catch you. Now, in my case, it was a couple of weeks ago, I was walking outside and it was a live thing out there that could have caused me to fall. But thankfully, I had enough awareness that I saw it, stopped, closed the door, turned on the light, looked outside, and avoided the rattlesnake that would have bit me in the back of the leg had I stepped out there. So, removing things that move in your house that are supposed to be fixed. So, mats, rugs, those things are important. I'm not saying you have to get rid of your rugs, but you don't want to have a rug that moves. So having a runner underneath it, or if it's old, replacing it or keeping it from curling up. Those are important things. It's a simple thing. They're talking about painting edges of steps. So if you're going outside, maybe having a reflective thing on a step so you know where the edge is. I've missed steps in my life because I didn't see it. So those are simple things that you may do on your own without any intervention. Glare is a tough one because we got a lot of sun, so it's hats and sunglasses and things like that. But it could also be, again, putting something that's going to change your visual awareness so you're not going to miss something or overstep, understep. Moving into the house and the bedroom specifically, having grab bars on things. So if you got stairs, having a handrail. In the shower, having grab bars to either climb in or hold on if you're unsteady or get in and out of the bathtub. Really, really important. We talked about the clutter. And then, of course, lighting is imperative. So as our eyes are waning, having better light in your house is always more important. Footwear. Now, those cute orange socks or yellow socks that are there on the slide, we give them to you at the hospital all the time. They don't do diddly. In fact, they've been scientifically proven to do absolutely nothing for reducing fall. In the hospital, it's probably more your foot in contact with things on the floor you don't want to be in contact with. But anti-slip socks can give you a little bit of stability in certain situations, right? So wet floors, icy conditions, things like that we don't really have to worry about here. Having good shoes. So if you have a shoe that looks like that your toes are poking out, or they're not quite the right size as you change in size as we get older, having good footwear on to give you stability. A lot of women that were in, say, the business industry in their life as they get older, they still want those cute, sexy shoes on that cram their toes into the point. And they got nice heels and they look fabulous. They're not always the best choice. So doesn't mean they have to be ugly, but having a shoe that's well fitted on your foot and stable is imperative. So we kind of talked about medications. There's lots of medications that can cause blood pressure and confusion, whether it's pain medicine and confusion or some of the nerve medications that we use for like peripheral neuropathy and whatnot. Those all can affect your cognizance of your surroundings and your ability to respond to a change in the situation. So if I had a nerve medication on board when I stepped out and stepped on the rattlesnake and I didn't see it because I wasn't aware, then I could have had a fall. Unfortunately, it would have been a fall in 2 holes in an ER visit. Obviously, there's a lot of heart conditions. High blood pressure, low blood pressure. The biggest thing you need to understand as you get older is your body doesn't respond the same way. And the medical term for that is called your baroreceptors. Those are little sensors inside your blood vessels. And so as your blood vessels aren't as flexible as they used to be, your baroreceptors don't work as well as they used to. So sudden changes of position, lying to upright, sitting to standing, you can have a decrease in your blood pressure temporarily, causing a near fainting episode, which then results in falls. Medications affect that as well. Ones that are appropriate for your cholesterol and your blood pressure and all that. I'm not saying stop those things. It's just, again, that kind of pharmacy comment earlier, kind of pay attention. You don't need to be on too much, but you need to be on what you need to be on. Obviously, as we get older, our eyes go. Cataracts and glaucoma are very common. Again, I'm 58. A month ago, I got a retina tear. For no reason, just noticed it at nighttime. So I've had 2 surgeries on my retina to help with my visual acuity. If I close one eye, it's perfect. The other eye, not so much. But because my one eye is still good, my brain will accommodate for that. But if I've got cataracts in both, and now everything's a little fuzzy, or macular degeneration where I don't see so clearly, these are things that you need to follow through on with other providers. We talked about vitamin D, right? Get out, get some sunlight. Now, you can take vitamin D orally, pill form. I take it daily. I take it for a multitude of reasons, not so much so my bone health, because I do that through exercise, but for just my immunological system. And I take 1,000 units daily. That is a medically recommended dose. It's not an absolute, but it's probably not something that's going to hurt you. I would check with your primary care. You should have a blood test before you just start throwing pills down your throat. But most of you in the room probably need a little bit of help. If you do fall, God forbid it happens, right? Don't panic. Assess everything. While you're laying there embarrassed, whether people are around or not, assess. Does anything hurt? Do my parts kind of move? Yeah, everything's good. I'm embarrassed. I'm mad. Well, move slowly. You know, again, you fall. You're laying flat. Kind of sit upright. Check your bearings. I mean, I work with the NFL, and if a guy's injured and he's lying flat on the field, we don't just pop him up and run off the field. We sit him upright. Let him sit there for a minute. We check again. We stand him up. We check again. And onward we go. If you're on the ground and you don't have the physical fortitude to just get up, then crawl towards something in the house that you can use to assist you. You know, go to a chair, a couch. You know, if you're outside, I don't want you to drag your butt across all the gravel, but, you know, try and get to something that can assist you in getting upright and move slowly. Obviously, if things are giving you signals something's not right, so if you break your hip and now your leg doesn't work, it may not hurt yet, probably does, but it may not, then if I don't have the stability to stand, then you're calling for help. Hopefully you've got your cell phone. Most of us don't have the button to push, you know, I've fallen and help me get up. If you hit your head in that process, I would strongly encourage you to seek aid. Now, aid doesn't mean you got to run to the doctor. Aid may mean you call your friend because you're alone and say, hey, Susie, I just hit my head. Could you call me in a half an hour? I'm okay, but I want you to check on me. And if you don't answer, then your friend should be making a phone call for you. And if you do have pain that's not associated with the level of your fall, then you should address it, which means come see us providers. You don't have to just rush to it, but it is something you don't want to ignore, because those bleeds, if they occur, they don't happen quickly, routinely. It's a slow process. And so again, back to my world, the sporting world, you know, a football player has a big hit, gets a concussion, they can cause blood vessels to bleed. Well, we reassess them on the field. We take them to the sideline. We put them in the tent. We check them again at halftime. And whenever things are going south, then they get escalated up to the next level of treatment. I have seen it where people have a simple injury on the field and they end up in the hospital. Those are in, you know, the world's best athletes. None of us in the room are that these days. We may think we still are, but, you know, assess. Don't let your ego get in the way of your health. Here's kind of a visual description on trying to get up. Again, we talked about it, but, you know, kind of in your house, kind of go towards a chair, a couch, a table, and help yourself slowly get up. Again, move slowly. In the grand scheme of things, we've kind of gone over all this. You know, in your visits with your providers, whether you're in my office as a specialist, I am a physician. I can talk to you about other things. I do a lot of non-orthopedic care in my office on a day-to-day basis. It is not inappropriate in my office for you to ask a question about something unrelated to me. I'll give you my 2 cents. I may tell you who to go see, or you need to call your doctor. And when you do have your visits, either annual visits or regular visits for prescription renewals, things like that, talk to them. I have an opinion that if a doctor comes in, sees you, and is rushing out the door, and you're like, oh, doc, and that doctor doesn't turn around and come back, or sometimes the question comes after we leave the room, so you talk to the medical staff. If that doctor doesn't come back in, or provider, nurse practitioner, or PA, doesn't matter, and answer your question, you may need a new one. You may need a new one. And that really stinks nowadays because it's hard to get into primary care. There's nobody accepting new patients. But I believe you want somebody invested in you. So you heard about my philosophy. I think you're hearing it in the theme. You heard it in the questions before the lecture. I'm invested in you all. I think it's an honor for you to come see me, not the other way around. And so you want some sense of that. We're all different, but you want some sense of that the physician, the nurse practitioner, the PA in front of you has a vested interest in you. And if they don't, then I think you need to find a new one, my opinion. Not always the easiest thing. As we get older, eyesight check, annual check. You know, it's just on the list of things that you need to do. So again, I talked about my retina tear. I need to go get a visual acuity test when enough time has gone by to make sure that I don't need glasses, right? You have to be your own advocate. And everybody's different, you know? So you can't use Susie's information and Dr. Smith for you. Unfortunately, a lot of us do because we have healthcare providers that aren't invested, and Susie sound really like they care. Be careful in that. You know, maybe you make an appointment with that provider, but don't just take the information and transfer it. So we talked about all these different things. Most of us nowadays are beyond the point of shoes that are just flying freely with laces. We have Skechers and anti-slip kick in. I have multiple pairs of them at home and they're awesome, and I'm not embarrassed to wear Velcro, although I don't have any yet. But all of those things are important. You know, get away the loose parts. If you need an assistive device, a cane, a walker, a scooter, use it. It's much better than the alternative, the emergency room and the bleed in your brain, and then you're in the nursing home for 3 months. I personally, as an orthopedic surgeon, like walking sticks. The reason I like a walking stick over a cane is you stand upright. Where a cane, you tend to lean over. There's nothing wrong with the cane, but a lot of canes are universally sized. And so obviously, as you can see, I'm a large human, and somebody that's 5 foot, we can't use the same cane. So I like walking sticks. They're collapsible. You can throw them in your purse, your backpack, take them on the airplane. They're easy and they're multi-use. Now, you can go to the National Council on Aging, just like I did, type it in, and there are these fitness programs for preventing falls. The Autogo one is an overall exercise program. We have things now called chair yoga. So if you're not as physically able because of arthritis and other things, there are things you can do at a minimalistic level to help thyself. Again, just take baby steps, keep working towards it. The YMCA, which we have several here in town, I've been in several of them. They're reasonable places. You don't have to go to a Choose in LA Fitness. Besides, the people that work there don't care about you. It's just money. But, you know, at the YMCA, there are specific programs that you can do that are helpful for you. That's something that's invested in our community. From my standpoint, I don't have anything more specifically for you. If you have any questions, please ask. This is just a picture of me and my wife's eyeballs, apparently, because it didn't come through. In Italy a couple of summers ago, just our first vacation without kids. It was kind of awesome.
Thanks, Dr. Endean. I do have a couple of questions that came in online. Hang on just a second here. Let me pull these up. So one of the questions was about, is there a bone maybe that is more susceptible to a fracture?
I think that's kind of age dependent. I think as we get into our 70s, 80s and beyond, compression fractures in your spine tend to be more common from the weakening bone, the loose bone. From a fall standpoint, I think your hip and your shoulder are at risk. Shoulder fractures a lot of times do not require surgery. It's just conservative care. Hip fractures almost always require surgery.
Okay. What can happen if you get a fracture and you don't get it treated right away?
Well, if you don't get it treated and it's out of alignment, then you're kind of stuck with what you have. We're surgeons, so we always will fix anything. But if bones aren't properly aligned and we have to correct them our way, it's usually a much bigger surgery and endeavor than allowing us to fix them in the first place.
Okay. And what if I came in for a visit after experiencing a fall that we think resulted in a fracture or some sort of an injury? What does that first appointment look like?
In my office, I usually, if you come to me with that story, I usually order x-rays on you before you come in because I don't have an x-ray machine in my office. A lot of orthopedic surgeons do, I do not. But usually it's an x-ray to rule out a fracture.
Okay.
You can do a physical exam to a degree and rule out a fracture, but it's not absolute.
Okay. And if we're looking to schedule an appointment, can you share with us where you're located? I know I've got your phone number that I'm going to go ahead and put up right now so that people have that. So if you're interested in an appointment, please give you a call at 520-324-6290. And where's your office located?
My office is on 2141 North Beverly, Suite 101. So I'm just across the street from the TMC campus. And for me, I prioritize getting people in. Some of you are in this room, have been in my office, and I would say getting in to see me is not routinely a long wait. It's a long wait only if I'm out of town, which is almost never. And long usually means 2 weeks or less. I often will, if you call today, I'll see you today.
Oh my goodness. Well, that's great. Thank you. Dr. Endean, I want to thank you so much from our online audience. I am going to wrap up with them and I'm going to turn it over to you for any questions in person. Thanks so much for being here.
Thank you.
Thanks again for joining us today. We are going to be back in on Tuesday, September 30th for Reclaiming Confidence, Connection and Well-Being After a Fall. That is going to be with Dr. Linda Hollis. She is with the University of Arizona's Department of Psychology. So if you're interested in that class, please give us a call. Our phone number is 520-324-1960. Hope you have a great day, and we look forward to seeing you next week.